Like most kids, Amelia Ellis isn't a huge fan of needles.
How are you feeling about getting your vaccine?
A little bit scared and worried.
The Canberra 8-year-old is one of the first Australian children aged 5 to 11 to get the COVID jab after they became eligible this morning.
Feel comfortable? Yeah? All right, let's go. I really wanted to get Amelia in straight away so that we could just get it done.
I'm a little bit nervous.
All the professionals have said that one dose is better than none.
All good to go through. You've got one of those. Thank you.
Children are given the Pfizer vaccine at 1/3 of the adult dose and will receive 2 shots 8 weeks apart. Experts say it's an important milestone in the pandemic.
Children between the ages of 5 and 11 really need to be protected from COVID infection. We do not want them to get COVID. We do know that it is a less severe infection than in older children, but there is still the possibility of more severe disease.
The stress levels have been extremely high for the last 2 years, as in so many areas. I am worried about my reception team.
Sydney GP Margot Davis was supposed to begin vaccinating kids at her practice this week. On Friday, she was told the delivery wouldn't arrive in time.
I was absolutely exasperated, and quite honestly, as someone who's pretty tough, I was very close to tears. Look, unfortunately, I'm going to have to reschedule your daughter's vaccination booked for Wednesday.
Her team rescheduled 50 kids' appointments, and then today, after 7:30 asked the health department about the delivery, the vaccines turned up.
I do believe that if you do commit to a date like we do, if we commit to a time and appointment, we have to keep to that.
The Department of Health told 7:30 it is continuing to work with GPs and pharmacies across the country to ensure they have sufficient doses.
I do want to emphasise again that there is enough paediatric doses in the country to offer every 5 to 11-year-old a first dose before they commence school this year. If you can't get an immediate appointment with your primary healthcare provider, if that is your GP, please do try the pharmacies, please do try the state hubs.
In the United States, hospitalisations have jumped in kids under the age of 5, but the overall hospitalisation rate among children and teens is still lower than any other age group. Paediatricians say recent data gathered in New South Wales during last year's Delta outbreak offers some encouraging insights.
It's very reassuring in terms of the low proportion of children requiring hospitalisation. And even those children who did require hospitalisation, a lot of those admissions were precautionary, with children being reviewed and only in hospital for 1 or 2 days. Over 90% of children not requiring oxygen.
The program that we have to have schools come back, stay back, day 1, term 1.
Attention is now turning to how kids can return to the classroom. Queensland has already pushed its school return date back, with New South Wales set to reveal its plan later this week. Teachers are still working out what term 1 will entail.
Some of the strategies like teaching outside, opening doors and windows for ventilation may or may not apply in various levels of efficacy depending on the location of the school and the architecture. Schools are going to have to be adaptive. We also have no idea about how many teachers may become unwell with this.
National Children's Commissioner Anne Hollands says closing schools should be a last resort.
School is about much more than academic learning that can be replaced by Zoom. School is a social learning environment where social and emotional skills are developed that are the platform for all academic learning and development and success in later life. During those lockdowns, we've also started to see the very negative effects on their mental health.
The Commissioner argues if supply chain issues are complicating the delivery of some vaccines, the Army could help out ahead of the school term starting.
If that's the only problem, then for heaven's sake, we've only got a few weeks to go. Get the army in now, because that's what we do in a crisis. Get them transporting the children's vaccines if we have to, because that's part of actually prioritising children now.
The Department of Health says more than 2 million paediatric doses are being distributed, and a further shipment of around 1.2 million doses is arriving shortly. Amelia's parents hope the return to school goes smoothly, but know better than to make plans during a pandemic.
I'd be lying if I said I wasn't a little bit nervous about what things are going to happen with Omicron and an environment such as a school, which, you know, people often say it's a petri dish. That said, I'm kind of not 100% keen for a remote learning experience again.
It felt like a mosquito biting you, like it didn't feel like anything.
You did fantastic.
You did so well.
I was brave.
High five.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.